Good morning, everyone. Let me introduce my PhD thesis, which is Impact of New Genomic Technologies on Patient Care. My name is Csendes. I'm a clinical geneticist resident, and I work at the Institute of Genomic Medicine and Rare Disorders at Semmelweis University. My vision is to boost the effective utilization of genomic technologies, and my mission is to recommend, develop, and support educational and financial policies. To achieve that, I have two ongoing projects. My first project is investigating the effectiveness of Spinraza in patients with spinal muscular atrophy with different functional abilities. SMA, spinal muscular atrophy, is a progressive hereditary neuromuscular disorder which results from the loss of the SMN1 gene, which leads to severe muscle weakness and atrophy. Without adequate treatment, it can be lethal under age of 2. So it is no wonder it is the most common genetic cause of infant mortality, with an incidence of 1 in 10,000 live births. Fortunately, within the last years, 2 disease-modifying therapy, Spinraza and Evrysdi, and 1 gene therapy, Zolgensma, have been approved for the use in SMA. Within our first study, we're going to focus on Spinraza. Spinraza is the first approved therapy back in 2016. It is administered via intratracheal injection. It is a lifelong treatment and extremely high-cost therapy. So there are 4 types of SMA based on the onset of the disease and the severity of the symptoms. However, SMA can be divided based on the functional abilities of the individuals at the time of their diagnosis, namely non-sitters, sitters, and walkers. So previous meta-analysis used the traditional classification. However, within our first study, we're going to apply the aforementioned groups. Why? It's because they correlate better with the outcomes to be examined and reflect the variability in therapeutic response in a more efficient way. So our aim is to investigate the effectiveness of Spinraza in patients with different functional abilities. Our clinical question is how the functional ability of the patients with SMA influence the effectiveness of Spinraza. To answer our question, we set up a PICO framework. Our population is non-sitter, sitter, and walker SMA patients. Our intervention is after Spinraza treatment, our comparator is before Spinraza treatment, and our outcome is effectiveness. We would like to measure the change in motor function. Our hypothesis is that the clinical effectiveness of Spinraza significantly depends on the functional ability of the patients with SMA. With this study, we wanted to highlight the importance, the early identification and prompt initiation of approved therapies, and to maximize the potential clinical improvement. We conducted a systematic search in 3 databases, and here you can see our finalized search key for that. After the systematic search, we got around 4,000 articles. And after the title and abstract selection, we got around 600 records. Here you can see the progress of my first project. We finished the title and abstract selection, and we are currently working on the full text selection. So my second project is investigating the effect of Spinraza and Zolgensma on the healthcare needs in patients with spinal muscular atrophy. So before the era of disease-modifying therapies, best supportive care was the gold standard for spinal muscular atrophy. It's a comprehensive and multidisciplinary approach that aims to address the various aspects of the condition. The key elements of that is the nutritional and respiratory support, orthopedic care, and rehabilitative services. I already mentioned the approved therapies, and I introduced to you Spinraza. However, I wanted to highlight that it is administered regularly and modifies RNA splicing. Meanwhile, Zolgensma, it is a one-time gene therapy and targets the genetic root of the disease. It's really important that to these days, treatments must be provided alongside to best supportive care. I wanted to highlight that earlier intervention, even in the presymptomatic stage, shows promising outcomes, which emphasize the importance of early diagnosis and treatment initiation. So for this reason, newborn screening has been initiated in many countries, including in Hungary. However, in many countries, it's still not the case. Our aim is to investigate the effect of addition of Spinraza and Zolgensma in healthcare needs compared to best supportive care. Our clinical question is, how does the addition of Spinraza or Zolgensma influence the healthcare needs compared to the best supportive care only? We set up once again a PICO framework to answer our question. Our population is presymptomatic individuals with SM11 gene deletion and patients with SMA type 1, 2, and 3. We want to compare best supportive care and Spinraza to best supportive care and Zolgensma to best supportive care only. Our outcome is the healthcare needs. Our hypothesis is that the addition of Spinraza or Zolgensma significantly reduced the healthcare needs compared to the best supportive care only. With this study, we're going to draw attention to the importance of acceleration of the diagnostic route and prioritize early treatment, and involving as many countries as possible into this newborn screening initiation program. In summary, hopefully this project will contribute to assess the different dimensions on treatment impact. And allow me to finish my presentation with the words of Peter Drucker: the best way to predict the future is to create it. Thank you for your attention.
Thank you so much for the nice presentation. May I have the first question is regarding the first project. When you assess the effectiveness of Spinraza, do you include both the clinical trials and the real-world data? And if yes, then do you distinct them or put together? What's your plan?
Our plan is basically to focusing on the real-world data, basically, because they included enough follow-up time or efficiently enough follow-up time, and it's going to be also very useful to us. And we wanted to probably discard the clinical trials at this point, but because we don't care about, we already knew that Spinraza is effective, right? Yeah. We just want to make sure in which group has the highest or different level of effectiveness of it.
So your additional value will be the much longer follow-up and those things? Okay.
Yes, also.
Thank you so much.
Thank you.
Any other question?
Congrats for your wonderful presentation. I would like to ask, is there any age limitations for administration of Zolgensma nowadays?
Yes, so thank you for your question. Basically, it varies from countries to country. However, generally, we can say that the US regulator, FDA, initially introduced Zolgensma for patients under age of 2. However, there are ongoing trials to focusing on to extend this age limitation. And if I'm not mistaken, it is called STIR study. And it's still ongoing. Yes, thank you.
Thank you. Any other question? Yes, please.
So congratulations on your nice presentation. Can you include presymptomatic patients into your study too?
Yes, thank you for your question. Definitely, because the newborn screening pilot program in Hungary is available since March this year. So we will definitely be able to include presymptomatic patients as well. Thank you.
Do you know how many patients we have pre-symptomatic here in Hungary? Just more or less treated?
I'm not quite sure, because we are treating in our institute the adult patients, unfortunately.
It's somewhere between 6 and 10. I don't know exactly, but it's pretty a number already. Thank you. Any other question?
Yes.
Yes, please.
So thank you for a nice presentation. My question would be, how do you plan to get access to the data that you need for your second project?
Yes, thank you for your question. So basically, we're going to request the data from National Health Fund Insurance because SMA is a well-defined and small population. We will be able to access the data from that. And actually, we have some experienced member of the team that they can help us, guide us through this whole process, basically.
Thank you.
Thank you.
And we still have time to ask. Yes, please.
Congratulations on your presentation. I was just wondering that why did you choose to group the data? To discuss the data in groups.
Yes, thank you so much for your question. Basically, previous studies indeed prove that Spinraza is effective. We know that, right? However, they fail to identify a specific recommendation regarding in which subgroup has the treatment the highest benefit, right? So SMA is a spectrum disorder, so I think it's really important to discuss an issue. So, and clinician and basically everybody would be interested in the different level of effectiveness in this, within this subgroup. Thank you.
Thank you so much. One more question, yeah. Okay.
Hi, I congratulate your presentation. Sorry about it, I am an orthopedic surgeon, so I would like to ask that how can you exclude the orthopedic rehabilitation during the Spinraza care? Because it has an effect on the functional ability.
But we don't want to exclude that.
And it's always different, the rehabilitation. Can you make a summary about it, or?
We just basically want to count the number of the orthopedic interventions. So we don't want to distinguish between the different orthopedic intervention, just to how many of them and are available for these patients. But we don't want to exclude them. Actually, that's the reason to talk about, to see how many of the patients need still the orthopedic interventions.
Thank you.